So hey guys, coming to the MPT entrance series of a Physio Sensei. In today's series, we have a question of an orthopedic slash sports. So this question goes like this. A patient with a history of a twisting strain and a locking of the knee joint is most likely to have option A, meniscal tear, option B, avulsion of the tibial tubercle, option C, tear of the ACL, and option D, tear of LCL. So let's dissect this question. In this question, we have two important content. First is a twisting strain and second is a locking. So coming firstly on the twisting strain, it is a mechanism of injury, and the locking, it is a complaint or a symptom which occur due to this mechanism of injury. So the examiner is going to test your anatomical knowledge to its application on the orthopedics or a sports condition. So if we again come to the first important part of this question, a strain. Strain basically define, it is a word given for a non-contractile unit. So in this question, we have three non-contractile units. First is a meniscus, second is a bone, a tibial tubercle, third is a ligament. First, let's see the option B, avulsion of the tibial tubercle. Any avulsion of a bony prominence require a high energy trauma, not any twisting or pivoting movement. So we are going to rule out this option because it always accompanies with the high avulsion or a high amount of force to displace, to fracture any bone of a body. Now, for a non-contractile unit, we have two other options. First is an anterior collateral ligament and the second is a lateral collateral ligament. Now, let's go more deeply on the lateral and the anterior collateral ligament is that the primary complaint when it comes to the ligament tear, either ACL, LCL or PCL, we don't see any locking chief complaint or symptoms. These ligaments, they don't lock the knee joint, they don't hamper the knee kinematics when they get avulged out or they get tear out. I'm talking about even the highest grade of a tear, third degree tear, in which the whole ligament is going to be teared out. They are not going to hamper the kinematics in which the femur is going over the tibia or tibia is going over the femur. Whereas if a meniscus is going to be tear, it is going to be acting as a wedge in between the femur and the tibia. When the femur or the tibia, they perform their normal kinematics in the movement of the knee joint. So with this, we correctly tick the option A for a meniscus tear, in which the twisting strain, a high twisting movement created by a torqueous movement of a femur over the tibia, creating a meniscus tear, giving a locking symptom. Thank you.